6 Home remedies for bedwetting. What is bedwetting? It can be an embarrassing experience for children to wake up in bed feeling wet from urination. It can also be very painful for parents to see their children go through this experience. The bedwetting experience is a common condition that is not just physiological but has a psychological impact as well. Bedwetting or enuresis is a condition where children beyond the age of 5 years involuntarily urinate in the night. This condition is not accompanied by any disease and affects 15% to 20% of children, 2% to 3% of teenagers while 0.5% to 2% of adults also suffer from this condition. Bedwetting normally occurs at night during sleep. In general, children with nocturnal enuresis, nocturnal for night, do not have daytime enuresis. However, it is estimated that almost 10% of children can have daytime wetting symptoms in addition to nocturnal enuresis. Causes of bedwetting. Children, who have a tendency to wet their bed, rarely realize the involuntary urination. This occurs due to various factors. Some of them are: inability to wake up from sleep, overactive bladder, delayed control of the bladder, constipation, consumption of caffeinated drinks like coffee or tea, psychological issues, genetic factors, nasal obstruction, sleep apnea, incontinence with no control on defecation or urination. Home remedies for bedwetting. Behavioral remedies and an educational strategy should be tried before resorting to any medication. There may also be role for complementary therapy to prevent bedwetting. The following are some of the home remedies for bedwetting. 1. Behavioral remedies. There are preventive measures that can be adopted to restrict the habit of bedwetting. Some of the measures include: reward program. This is one of the initial measures adopted during the training young children for bedwetting. Children are rewarded when they have a dry night, which makes them feel encouraged to continue this positive progress. However, the downside is that children may feel disappointed and discouraged if they regress and have a wet night that makes them lose out on their reward. Urinate twice before going to bed. The child is asked to urinate just before getting ready to go to bed. After the child is in the bed, the child is made to urinate again just before sleeping. Reduce liquid consumption in the evening. Deprivation. The child is encouraged to drink a lot of fluids during the day. However, the consumption of liquids is restricted by evening. This allows the child to empty the bladder before going to bed. 2. Urinate twice before going to bed. Improve bladder capacity. Reduced capacity of bladder may render the bladder incapable of holding the overnight urine, leading to bedwetting. Increasing the bladder capacity may help the child overcome bedwetting. During the daytime, the child is made to hold the urine a little longer to increase the bladder capacity. 3. Reduce liquid consumption in the evening to avoid bedwetting. Use of a night lamp. Children can be encouraged to use the toilet in the night by keeping a night lamp on. This can help dispel fear of darkness that prevent children from accessing the toilet. 4. Timed urination. Following a schedule, the child is made to wake up in the night to urinate. This helps create a body clock for the child to get into a routine for urination and prevent bedwetting. This can also help older children, teenagers, and adults to wake up and urinate. Some parents use a code word with the child while waking them up to ensure the children are awake when they urinate. 5. Alarms. Children are made to sleep on mattress pads or mats that have electrical alarms set in them to detect urine that falls on them. There are also alarms that are attached to the body with sensors in the underwear. The alarms are either light devices or alarms with vibrations or sounds. 6. Carrying the child. Parents try to get the child to urinate and empty the bladder while asleep, thus avoiding the consequence of bedwetting. This procedure is known as lifting. Behavioral and educational strategies in the management of bedwetting.